is probably the most transformative modality to come down the medical pathway in the last 50 years.
90% of our patients are achieving almost 90% relief of their symptoms, which is unheard of.
And it's going to revolutionize the way patients are taken care of.
It's changed our practice, I think, in the ability to offer these types of treatments, and the confidence I have in saying, I can help you.
You see someone that has such debilitating pain in their shoulder, their knee, or their back, and 1-2 treatments, and they're 80–90% better.
What we're seeing in the clinical practice, both acute and chronic, is just amazing.
And I think this is frankly, the edge of a tidal wave. I think you're going to see within the next 5 years a significant shift in medicine towards utilization of this type of therapy for patients across the board, across specialties.
It's always better to be able to treat patients faster, get the results in the shortest amount of time possible with the latest and the best technology.
That technology is MLS laser therapy from cutting-edge laser technologies. Doctors across various specialties have been amazed by its ability to accelerate healing and alleviate pain.
If you wanted an alternative to medicine and surgery, a laser by far and beyond of any modality I've ever used in the physical therapy world, this is the best.
I put myself under this laser the day after we got it. I did my shoulder and my knee, and that night I realized that I had no pain in my shoulder or knee after 1 treatment. It works.
How it works is by employing 2 synchronized wavelengths of light, which transfer energy to damaged tissues at the cellular level.
That light triggers metabolic reactions in the cell that stimulate healing, that stimulate reduced inflammation, and stimulate pain reduction.
And so we can get a dual treatment approach, if you will, with both inflammation and pain reduction. It's unmatched. I've used other systems before and have never gotten the effect that I have with the MLS system.
MLS laser therapy is the result of 30 years of research and was initially used by veterinarians in the United States, with uniformly astounding results. That led to a series of academic studies focusing on human applications.
The MLS laser therapy has been well validated through a variety of clinical trials in some of the most world-renowned institutions worldwide. So we brought the technology to market based on the clinical validation of the science behind it.
And after going through the different scientific studies, a lot of them out of Harvard, I was intrigued by the impact this light energy has on the cells. And to be able to decrease the inflammation pathway and the swelling on a cellular level, it makes sense that you thereby decrease the pain.
For patients across America, MLS laser therapy has meant relief from often intractable pain, without medication, without surgery.
I'm getting amazing results, and I can't wait to send other people in here to get the same benefits from it.
Even throwing a football, I can throw a football a lot better now than I could 2 years ago.
Like, I'm so excited about it, and I tell everybody about it.
Even now, after several months, I have no pain in my knee.
It was like a mega dose of Advil and ice invisibly, and it was just amazing.
It was the second treatment, and I walked out of here and I knew that something was different. And I called him back up and I said, "Thanks a lot. I think there may be something to this."
The primary MLS laser therapy unit has a touchscreen menu that allows doctors or staff to easily select a treatment. The robotic head does the rest. There is also a separate handheld probe that is preferable for some treatments, including trigger points.
Actually, we have 2 lasers in one. We can utilize the handheld unit in any smaller joints. I have used it on TMJ, and it works absolutely great.
Shoulders, feet, hands, wrists, things like that. The trigger point probe is more effective at getting at the nerves.
That is why the cutting-edge MLS laser is often described as nothing short of revolutionary.
It's achieving results that have never been achieved before in treatment times that are shorter than have ever been expected before. So that's really why we view this as revolutionary.
It has revolutionized our practice in that I can sit there and not feel like a failure as a physician, offer them something that has no downside, and these people are getting better. So every day I come to work, I feel like I have my ace in the hole.